အားလုံးပဲမင်္ဂလာပါဆလို့ရလား
Yeah.
Okay အားလုံးပဲမင်္ဂလာပါ Good afternoon ladies and gentlemen, friends and colleagues. First of all, I would like to welcome you and send my good wishes to all the speakers and the audience who are attending this mini symposium. Today's symposium is entitled Exercise is Medicine, the exercise prescription for health. So, and to start this mini symposium, I would also like to thank the academic committee of this 67th Myanmar Medical Conference for giving me the honor and privilege to share this very important mini symposium. So as we all know, physical exercise and physical activity and exercise has become an integral part in the healthy lifestyle of all human beings. And it has become essential because it has many benefits, physiological benefits for the body, which is very, very important for the maintaining and promoting the health of all of us. And many studies have found that in addition to maintaining and promoting the health of all of us, it is also very important that it has a preventive aspect also, and also in the treatment and rehabilitation, and also the mitigation of many diseases. Among very important are the ones which are the leading causes of mortality all over the world, such as hypertension, coronary heart disease, and the pulmonary diseases such as COPD, bronchial asthma, and the important ones of the metabolic diseases such as diabetes mellitus, obesity, dyslipidemias, and a number of neurological diseases and psychiatric diseases. They have a beneficial effect for not only for physical but also on the mental condition of all these patients. So as we know that there are these beneficial effects of all these physical activity and exercise on all the people, there has become an evidence that there needs to be become the physical activity and exercise needs to become a culture or a routine in our everyday lives, where one would feel incomplete without a few minutes of physical activity and exercise during the day. So this needs to become a culture in all of us. And moreover, the medical profession and the healthcare providers need to build a culture of promulgating the physical activity and exercise in our daily clinical management. So in this condition, why the exercise is medicine comes in. Exercise is medicine is a global initiative to establish physical activity and exercise as a standard in healthcare. So if all the medical providers need to perform the physical assessment of all the people who are to be engaged in an exercise, whether they be the personal or individualized exercise, or whether they are to be engaged in a gymnasium or any workout plan. So the first thing very important is to assess the condition of these people, whether they be healthy or they are patients, and then what the next thing is for the health provider to prescribe the exercise for these patients. Without the preliminary physical examination, it would be hazardous if we should miss something. So for the prescription, this is, you don't need any financial assistance for this exercise, because we have to do it. So this is an important thing to do, that is that when we prescribe, we have to, I think these will be done by the speakers, lady. So I won't go into detail, but the frequency, the prescription, the people, the health providers who give the prescription needs to give the frequency of the exercise, the intensity, how much the patient has to undergo, whether it's going to be a mild, moderate, or a vigorous one, and what time or duration does he have to make it or take it, and what type of exercise. So in this symposium, this will aim to highlight all these factors of the physical activity and exercise. And without much ado, we have altogether 3 speakers in this symposium. And I think I would like to call upon the first speaker, Dr. Ye Tin Lin, to the podium. And Dr. Ye Tin Lin is a retired Deputy Director General of Department of Medical Research, and at present he is a very active General Secretary of Exercise is Medicine, Myanmar. Please, I would like to call upon Dr. Ye Tin Lin to deliver his paper.
Good afternoon, Chairperson, ladies and gentlemen. Today, I would like to discuss on pre-participating health screening before engaging in exercise program. Physical inactivity is fast-growing public health program and contribute a variety of chronic diseases, including obesity, hypertension, diabetes, and cancer. Regular physical activity reduces all-cause mortality, cardiovascular disease including hypertension, stroke, type 2 diabetes, colon cancer and breast cancer, Alzheimer's disease, dementia, depression. There is up-to-date evidence-based basis for prescribing exercise as medicine in the treatment of 26 diseases. Single therapy, without drugs, low cost, least side effect, do it yourself, useful for prevention of many non-communicable diseases, treatment and rehabilitation of the patient, and promotion of health and fitness is exercise. So, exercise is medicine. Exercise is medicine is a global initiative to establish physical activity as a standard in healthcare. There is a risk of acute musculoskeletal injury during exercise. Major concern is the increased risk of sudden cardiac death and acute coronary events for high-risk individuals. These events are greatest in those individuals performing unaccustomed physical activity and is greatest during vigorous intensity physical activity. To avoid these side effects, the pre-participating health screening is required. The purpose of pre-participating health screening to identify individuals with medical contraindication, to detect individuals who should undergo a medical evaluation or exercise testing before initiation an exercise program, to recognize individuals who should participate in medically supervised exercise program. It consists of self-guided screening and professionally guided screening. Self-guided screening is carried out by the exercising individual or by allied health professional. Use some validated questionnaires. One is AHA ACSM Health Fitness Facility Pre-Participating Screening Questionnaires. It consists of 3 parts. History consists of heart attack, heart surgery, cardiac catheterization, and various cardiac disease. Symptom consists of experiencing chest discomfort with exertion, unreasonable breathlessness, dizziness, fainting, blackout, taking heart medication. Other health issues include musculoskeletal problem, concerns about the safety of exercise, taking prescribed medication, and being pregnant. If any of the statements is present, the person should consult healthcare professional. Cardiac risk factors include a man over 45 years, a woman over 55 years or have had hysterectomy or postmenopausal, smoker, blood pressure more than 140/90, do not know the blood pressure, take the blood pressure medication, blood cholesterol level more than 240 milligram per deciliter, do not know cholesterol level, history of heart attack before age 55, father or brother, or age 65, mother or sister, being diabetic or taking medicine to control blood sugar, physically inactive, that is less than 30-minute physical activity on at least 3 days per week, more than 20 pounds overweight. If two or more of the statement, consult healthcare professional. Another one is physical activity readiness questionnaires, known as PARQ. It consists of 7 questions. 1. Has a doctor ever said that you have a heart condition and recommend only medically supervised activity? 2. Do you have a chest pain brought on by physical activity? 3. Have you developed chest pain in the past month? 4. Have you one or more occasions lost consciousness or fallen over as a result of dizziness? 5. Do you have a bone joint problem? Could be aggravated by proposed physical activity. 6. Has a doctor recommend medication for your blood pressure or heart condition? 7. Are you aware, through your own experience or doctor's advice, that would prohibit you from exercising without medical supervision? If yes to any of these questions, consult your physician. If no, start the physical activity. Begin slowly and build up gradually. Professionally guided screening. Cardiovascular disease risk factor assessment and classification should be conducted by qualified health fitness professional or clinical exercise or healthcare professional. Major signs and symptoms such as your cardiovascular, pulmonary, and metabolic disease are pain, discomfort, or other angina equivalent in the chest, neck, jaw, arms, or other areas that may result from ischemia, shortness of breath at rest, or with mind exertion, dizziness or syncope, atopia or paroxysmal nocturnal dyspnea, ankle edema, palpitation or tachycardia, intermittent claudication, no heart murmur, unusual fatigue, or shortness of breath with user activities. Atherosclerotic cardiovascular disease risk factor consists of age, men equal or over 45 years, women equal or over 55 years, family history of myocardial infarction, coronary revascularization or sudden death before 55 years in father or brother, or before 65 years in mother or sister, cigarette smoking, sedentary lifestyle, obesity, hypertension, dyslipidemia, pre-diabetic. One negative factor is HDL over equal or more than 60 milligram per deciliter. Logic model for risk classification. If there is no cardiovascular, pulmonary, or metabolic diseases, classify as high risk. If major signs, symptoms such as your cardiovascular, or pulmonary, or metabolic disease, it also classifies as high risk. No cardiovascular, pulmonary, metabolic disease, as well as major signs, symptoms such as your cardiovascular, pulmonary, metabolic disease. But if there is cardiovascular disease risk factor equal or more than 2, classify as moderate risk. If less than 2, classify as low risk. Medical evaluation, including physical examination and stress test, exercise testing, conducted by qualified healthcare provider. Exercise testing before initiating the physical activity program is not routinely recommended, except for individuals at high risk. No set of guidelines for exercise testing prior to initiation of physical activity cover all situations. Local circumstances and policies vary, as well as specific program procedure also vary. Supervision or exercise testing. Degree of supervision varies from physician-supervised test to situation in which there is no physician present. For testing high-risk individual, non-physician healthcare professional trained in clinical exercise testing can be supervised with a physician being immediately available. For moderate risk individual, non-physician healthcare professional trained in clinical exercise testing can be supervised, but whether or not a physician must be immediately available is depend on local policy and circumstances, health status of the patient, and training and experience of the laboratory staff. For low-risk individuals, non-physician trained in clinical exercise testing can be supervised without a physician being immediately available. Skill and facility requirement. Physicians responsible for supervising exercise testing should meet or exceed the minimum competencies for supervision and interpretation of results as established by American Heart Association. Site personnel should at least be satisfied at a level of CPR AED training. Preferably, one or more staff members should also be satisfied in first aid ACLS. All exercise testing facilities, with or without physician supervision, should have a written medical emergency response plan with procedure and contact numbers, should practice this plan at least quarterly, be equipped with a defibrillator or AED. ACSM recommendations based on classification of risk for a medical examination, exercise testing, supervision or exercise testing before participating in moderate to vigorous intensity exercise. Low risk, asymptomatic, less than 2 risk factor, medical examination, exercise testing, and medical doctor supervision or exercise testing are not required. Moderate risk, asymptomatic, equal or more than 2 risk factors, medical examination for moderate intensity exercise is not required. For vigorous intensity exercise, medical examination is required. Exercise testing, medical supervision, medical doctor supervision or exercise testing are not required. High risk, symptomatic or no cardiovascular, pulmonary, and renal and metabolic diseases, medical examination, exercise testing, and medical doctor supervision or exercise testing are required. To examine the effectiveness of ACSM pre-participating screening in adult, evaluation was done. They found that 95.5% of women, 93.5% of men would have received a recommendation for further medical screening. Excessive referrals presented an unnecessary barrier to exercise adoption and stress healthcare infrastructure. Elaborate screening and referral create barrier to engaging in physical activity. So, a scientific roundtable was convened by ACSM in 2014, evaluate the former exercise pre-participating screening and propose new evidence-informed model. Reason for new recommendation: because of well-known health risks of physical inactivity, increasing evidence that exercise is safe for most people and has many associated health benefits. Motivating people to be physically active is a significant challenge. The absolute risk of cardiac events is low in healthy individuals, and even the risk is lessened as people become physically active and fit. Exercise-related cardiovascular events are often preceded by warning signs symptoms. Exercise testing is a poor predictor of coronary vascular disease events in asymptomatic individuals. Furthermore, there is a lack of consensus regarding the extent of medical evaluation need. So, the new health screening process is based on 3 factors. 1. Individual's current level of physical activity. 2. Diagnosed cardiovascular, metabolic, and renal disease, or presence of signs, symptoms of cardiovascular, metabolic, or renal disease. 3. Desired exercise intensity. According to this, if the individual participates in regular exercise, if he or she has no cardiovascular, metabolic, or renal disease, or no signs, symptoms suggestive of cardiovascular, metabolic, and renal disease, medical clearance not necessary, continue moderate or vigorous intensity exercise may gradually progress. If he or she has no cardiovascular, metabolic, or renal disease and is symptomatic, medical clearance or for moderate intensity exercise not necessary. Continue with moderate intensity exercise. Before engaging in vigorous intensity exercise, medical clearance is required. Following medical clearance may gradually progress as tolerated. If he or she has any sign symptom suggestive of cardiovascular, metabolic, or renal disease, regardless of disease status, discontinue exercise and seek medical clearance. May return to exercise following medical clearance, gradually progress as tolerated. If the individual does not participate in regular exercise, if he or she has no cardiovascular, metabolic, renal disease and no signs symptoms suggestive of cardiovascular, metabolic, and renal disease, medical clearance not necessary. Light to moderate intensity exercise is recommended. May gradually progress to vigorous intensity exercise. If he or she has no cardiovascular, metabolic, or renal disease and is symptomatic, medical clearance recommended. Following medical clearance, light to moderate intensity exercise recommended. May gradually progress as tolerated. If he or she has any signs, symptoms suggestive of cardiovascular, metabolic, or renal disease, regardless of the disease status, medical clearance recommended. Following medical clearance, light to moderate intensity exercise recommended. May gradually progress as tolerated. Risk factor stratification has been removed in new screening process. The old guideline recommend which patient should receive further medical examination or exercise tests. New guideline empower the healthcare provider to give medical clearance. Healthcare providers should decide what further evaluation are appropriate before starting a new moderate to more vigorous intensity exercise program. Decision about conducting more advanced screening prior to initiation of exercise program should be made on individual basis. New ACSM recommendation for exercise testing. Diagnose cardiovascular disease, unstable or new or possible symptom of cardiovascular disease, diabetic mellitus, and at least one of the following: age over 35 years or type 2 diabetes over 10 years duration, type 1 diabetic mellitus over 15 years duration, hypercholesterolemia, hypertension, smoking, family history of coronary arterial disease in first degree relative less than 60 years, presence of microvascular disease, peripheral artery disease, or autonomic neuropathy, end-stage renal disease, patient with symptomatic or diagnosed pulmonary disease, including chronic obstructive pulmonary disease, asthma, interstitial lung disease, and cystic fibrosis. In conclusion, screening based on current physical activity level, sign symptom of disease, planned exercise intensity. Advanced screening, including exercise testing, are conducted on high-risk individuals. After medical clearance, engage the appropriate exercise program. The great benefit of physical activity, universal risk of inactivity, serious adverse events of physical activity are relatively rare. The cardiovascular disease risk of light to moderate intensity physical activity approximate death at rest. So, the screening process should not be a barrier for a person to start a physical activity program of low to moderate intensity. Thank you.
Good afternoon, Chairperson, ladies and gentlemen. Please may I present Principle of Exercise and Recommendations. First, physical activity. Any bodily movement produced by the contraction of skeletal muscle that increases energy expenditure above a basal level. It includes daily activity, occupational activity, transportation activity, and leisure time activity. What about exercise? A planned, structured, and repetitive body movements are performed for the purpose of the improvement or maintenance of one or more components of physical fitness. Okay, sport. Sport covers a range of physical activities performed within a set of rules and undertaken as part of leisure or competition, carried out by teams or individuals, and are supported by an institutional framework such as sporting agency. Okay, exercises, medicine. As everybody knows, medicine depends on type, dose, frequency, duration, adverse effects, and also effect of exercise depends on all these 5 factors. So effectiveness of exercise depends on F for frequency, I intensity, T time, and the T for type. To get all of the benefits of physical activity, please try all 4 types of exercise. They are aerobic training, strength and resistance training, balance workouts, and flexibility. First, endurance or aerobic activities. Yeah, cardiorespiratory exercise, improve body composition and cardiorespiratory fitness, and involve major muscle groups, be continuous and rhythmic in nature. These are examples of aerobic activities: brisk walking, bicycling, dancing. Nowadays, Zumba dancing is very popular, and I'm very fond of it. Low impact aerobics, swimming, stair climbing, rowing, cross country skiing, etc. So number 2, strength exercises. It improves muscular mass fitness such as muscular strength and endurance, and better mobility and balance, protect the bone. The activities chosen should work all the major muscle groups of your body. So what are the strength training activities? As we can see here, weight machines or free weights at gym, lifting light weights or objects like canned goods or water bottles, and using elastic bands as resistance bands, and calisthenics or exercises that use your own body weight to work your muscles. Example like push-ups, sit-up, squats, lunges, wall sits, and this is planks. And don't worry if you can not go to the gym. You can substitute with other activities that build and keep muscle, like heavy gardening, digging, shoveling. Number 3, balance exercises. No doubt they improve neuromuscular fitness, such as balance, posture, and prevent falls. For example, try standing on one foot, then the other. If you can, don't hold on to anything for support. And another thing is, get up from a chair without using your hands or arms. And walk heel to toe. As you walk, put the heel of one foot just in front of the toes of your other foot. Other examples are Tai Chi, use of a Swiss ball, use of a balance board. Number 4 is flexibility exercises. As the name implies, it improves flexibility to get full range of movement. Stretch your muscles and can help your body stay limber, but please don't stretch so far that it hurts. So after discussing the type of exercises, we will go on to how much physical activity is needed for each and every one of us. And it depends on age of the person. And first we go on to adult. And it stated that moderate intensity aerobic activity, that is brisk walking, 150 minutes per week, and muscle strengthening activities on 2 or more days a week that will work all major muscle groups. Or if you want to increase the intensity, vigorous intensity, aerobic activity, that is jogging or running, the duration is reduced to 75 minutes per week. And muscle strengthening activities on 2 or more days a week that work all major muscle groups. Or an equivalent mix of both moderate and vigorous intensity aerobic activity and muscle strengthening activities on 2 or more days a week that work all major muscle groups. To be more simplified, example 1 is for moderate intensity activity, and muscle strengthening activity. Sunday, there is 30-minute brisk walk and follow on same on Monday, Tuesday. Then on Wednesday, there will be weight training, followed by 30-minute brisk walk on Thursday, Friday, and followed by weight training on Saturday. Total 150-minute moderate intensity aerobic activity plus 2 days muscle strengthening activity. Example 2 is for vigorous intensity activity and muscle strengthening activity. Here, there is only 4 days, and it will start on Monday with 25-minute jogging, and on Wednesday, 25-minute jogging and weight training, followed by weight training on Friday, followed by 25-minute jogging on Saturday. Total 75 minutes vigorous intensity aerobic activity plus 2 days muscle strengthening activity. So what about the mixed one? As the name implies, it is totally mixed. On Sunday, 30 minutes brisk walk, followed by 15-minute jogging on Monday, weight training on Tuesday, 30-minute brisk walk on Wednesday, weight training on Thursday, 15-minute jogging on Friday, followed by 30-minute brisk walking on Saturday. Total, the equivalent of 150 minutes of moderate intensity aerobic activity plus 2 days muscle strengthening activity. Okay, what about according to the steps? Recommended number of steps per day, it depends on the objective of the exercise. To be considered active, at least 6,000 steps per day. To prevent obesity, 10,000 steps. To lose weight, 12,000 steps. And for children and adolescents, 9,000 steps per day. Then we will move on to children and adolescents. Here, the duration is increased to 60 minutes or more of physical activity each day. Aerobic activity, 60 or more minutes each day, either moderate intensity aerobic activity such as brisk walking or vigorous intensity activities such as running. But to make sure that it should include vigorous intensity aerobic activity on at least 3 days per week. Number 2 is muscle strengthening. Include muscle strengthening activities as we have discussed before, such as gymnastic or push-ups as part of 60 or more minutes per day activity, at least 3 days per week. Bone strengthening, such as jumping rope or running as part of 60 or more minutes per day activity, at least 3 days per week. So let's go on to pregnancy and exercise, whether we should do exercise or not during pregnancy. Unless you have a medical reason to avoid physical activity, please begin or continue moderate intensity aerobic activity during and after pregnancy. But start slowly and increase amount gradually over time. And healthy women who already do vigorous intensity aerobic activities such as running can continue but should be adjusted over time. But one important thing is they should avoid doing any activity that involves lying on their back or that puts you at risk of falling or abdominal injury, such as horseback riding, soccer, or basketball. So what about elderly? Almost anyone at any age can do some type of physical activity. But older adults should determine their level of effort for physical activity relative to their level of fitness. The amount of exercise to be done is quite similar to adults. You can still exercise even if you have a health condition like heart disease or diabetes, but it is very important to check with your doctor if you are over 50 and you aren't used to energetic activity. So what about measuring physical activity intensity? As shown on this slide, there are various methods, units to measure the intensity like kilocalories, VO2 max, percentage of maximum heart rate, repetitive maximum, etc. A simple way to measure relative intensity is the talk test. If you can talk but not sing during the activity, you are doing moderate intensity activity. If you are not able to say more than a few words without pausing for a breath, you are doing vigorous intensity activity. So it is a very simple way to measure relative intensity by using the talk test. Okay. This is our chairperson, our CIE, and me during an event of exercise. Exercises medicine. Okay, so let's continue the components of a single exercise session. It consists of warm-up, conditioning, cool down, and stretching. Warm up, at least 5 to 10 minutes of low to moderate intensity aerobic exercise or resistant exercise with lighter weight should be done before doing exercise and vigorous activity, because we should activate our heart, activate our muscle, blood circulation to be ready for exercise. Then followed by conditioning, 0 to 60 minutes of aerobic, resistance, neuromuscular, and or sport activities. Then after this, you should not stop it abruptly. It should be followed by cool down, at least 5 to 10 minutes of low to moderate intensity aerobic exercise or resistant exercise with lighter weights to reduce our heart rate, circulation, and to cool down state. Then after that, stretching. At least 10 minutes of stretching exercises performed after the warm-up or cool down phase. Before I conclude my presentation, I would like to discuss and advise some safety tips, which is very important for our exercise. Whenever you do exercise, please start slowly, especially if you haven't been active for a long time, and little by little, build up your activities and how hard you walk at them. Another important thing is don't hold your breath during strength exercises, because it could cause changes in your blood pressure, increase the blood pressure. And use safety equipment, or wear a helmet for bike ridings or the right shoes for walking or jogging. And another important thing is drink plenty of fluids when you are doing activities. During activities, there are a lot of sweat, you lose fluid, electrolytes, and you must replenish the fluid. Many older adults don't feel thirsty even if their body needs fluids, so please don't forget to drink plenty of fluids. And always bend forward from the hips, not the waist. And as we have already discussed, warm up your muscles before you stretch. Try walking and light arm pumping first. And very important safety tips is that exercise should not hurt or make you feel really tired. You might feel some soreness, a little discomfort, or a bit worry, but you should not feel pain. In fact, in many ways, being active will probably make you feel better. And please don't forget to check with the doctor whenever you feel dizziness, shortness of breath, chest pain or pressure, or the feeling that your heart is skipping, racing, or fluttering, or any new symptoms, infection, fever, muscle aches. It's very important to consult your doctor. Unplanned weight loss, ankle sores, joint swelling, hernia, etc. Only then will exercise be safe, and it will be medicine for us. These are the references. And thank you very much for your attention.
Thank you very much, Dr. Omar Miente. She has touched a lot on the general principles of physical activity and exercise, and has talked comprehensively upon the the types of exercise and the intensity which are to be taken with the different ages. And the most important thing are the safety tips which he has given. I think without much ado, I would move on to another speaker, Professor Kim Yu La. Professor Kim Yu La she is the professor and head of Department of Physical and Rehabilitative Medicine at the University of Medicine 1, Yangon, and Yangon General Hospital. And she is a leading physiatrist and national coordinator for the development and implementation of National Rehabilitation Strategy since 2015. And she is also an active member of the Technical Committee of Exercise as Medicine, Myanmar. May I now call upon Professor Kim Yu La to speak on the exercise prescription for patients with various diseases.
Good afternoon, our beloved teacher, Mama Dr. Meo, Madam Chairperson, our senior and junior colleagues, ladies and gentlemen. Thank you for inviting me to the EIM Symposium. Today, I'm going to talk about exercise prescription for patients with various diseases. These are the contents of my presentation. These are the list of the various diseases which I'm going to present how we are going to prescribe the exercise for these diseases. Why physical activity and exercise is important. After high blood pressure, tobacco use, and a high blood glucose, physical inactivity constitutes the fourth leading cause of the death globally. Studies shows that a low level of the physical activity exposes a patient to a greater risk of the dying than does smoking, obesity, hypertension, or high cholesterol. The commitment and belief of the EIM is that exercise and physical activity are integral to the prevention and treatment of the chronic diseases and should be regularly assessed as part of the medical care. EIM team strives to make physical activity as a sixth vital sign that is routinely assessed at every patient interaction with a healthcare provider. These are the benefits of the physical activity and exercises. So it can reduce the mortality and the risk of the recurrence of the breast cancer by approximately 50%. Exercise and physical activity also lower the risk of the colon cancer by over 60%, risk of the developing Alzheimer's disease by approximately 40%, reduce the incidence of the heart disease and high blood pressure by approximately 40%, and lower risk of the stroke by 27%, lower risk of the developing type 2 diabetes by 58%, and so on. Now, I would like to share the type of the exercises. There are four main types of the exercises: flexibility exercises or range of motion exercises, strengthening or the resistance exercises, cardiovascular endurance, and aerobic activity exercises. These activities are such as walking, cycling, jogging, and swimming, rely primarily on aerobic energy producing systems. And then the last thing is a balance and coordination exercises. Together with all these four main exercises, activities like Tai Chi, yoga, Pilates can combine the flexibility, balance, and resistance activities. Together with these four exercises, it is important to keep the correct posture and avoidance of the faulty body mechanics. It's also essential to reduce the prevalence of the musculoskeletal and pain conditions and arthritis. When you prescribe the exercise, we usually follow the FIT principle: frequency, intensity, time, and the time and the type. Pre-participation health screening is essential before we prescribe the patient to do the physical activity and exercise. This is an algorithm or pre-preparation health screening by asking the question that does the individual currently exercise regularly? And when we follow the algorithm, so we know that some individuals may go straight to the exercise activity, some may go straight to the some may need to do for the medical clearance and medical examination and test. It is essential to take the precautions before and after studying after the exercises. It is advisable to talk to your healthcare provider before you start the exercise program. Warming up, stretching, and cooling down properly. Wearing the right shoes is essential. If you feel the pain or discomfort, it is better to avoid or modify the exercise program. Do not ignore your body's signal of fatigue, discomfort, and pain. It's better to take all the medications prescribed by your doctor during your exercise program. You need to stop the exercising and seek medical help. If you experience the symptoms such as discomfort or pain, severe chest pain and other pain, that would indicate symptoms of the heart attack, extreme breathlessness, very rapid or irregular heartbeat during the exercises. Now comes the exercise restriction for the patients with the COPD. Shortness of the breath is the main problems of the patients with COPD, and they don't want to do the exercises which reduce their fitness level. It's better to start slowly. Just 10 minutes of walking each day is enough, and you can take as many breaks as you need. According to the exercise program, aerobic activity, at least 150 minutes per week of the moderate intensity, or the 75 minutes of the vigorous aerobic activity is recommended. For the muscular strength training, twice per week for the large muscles is enough. And if you want to monitor your functional status and status during the exercise, if you can carry on the conversation while working at a moderate pace, your condition is okay during the exercise. This is a type of the exercise program for the COPD. So I'll skip these slides. The 6-minute walk test is very essential to assess the function of the exercise capacity in individuals with severe pulmonary diseases. The modified walk category ratio score is extensively used to measure the dyspnea before, during, and after exercises. The modified walk scale is this is very beneficial for the patients, not only for the COPD, but also for all the cardiovascular health conditions. For these conditions, here we add some of the breathing exercise program, and the benefits of the breathing exercise is very huge. So it can improve the ventilation, increase the effectiveness of the cough mechanism, prevent the pulmonary impairments, improve the strength, endurance, and coordination of the respiratory muscles, and so on. There are 3 types of breathing exercises: diaphragmatic breathing, positive breathing, segmental breathing. So we call it, this is a apical and lateral costal expansion exercises. This passive breathing is, according to the report, passive breathing decrease in the passive level of the exertion during the activity. Now, exercise prescription for the asthma. We have divided 3 groups of the training. One is a breathing retraining, respiratory muscle training, and the musculoskeletal training. Like the COPD, aerobic activity and strength training are recommended. But for the indoor pool training and exercises are not advisable, because there will be many chemicals inside the pool, and which can worsen your asthma. Now comes the exercise with the blood lipid disorders. A good diet, medications, reduce body weight and fat, and regular physical activity are the best way to lose weight, and then you reduce the blood lipid level. You will start with the aerobic exercises to burn the calories. It is recommended to walk at approximately 10,000 steps per day. To reduce your LDL levels, aim for the exercises at 250 to 300 minutes of the exercise each week. So you need to burn at least 2,000 calories a week. Although the large muscle stretching and strengthening exercises is essential. Regarding exercise for the high blood pressure, regular physical activity, healthy diet, and a healthy lifestyle, and the medications are the major roles to reduce the blood pressure. Aerobic activity and then muscular strengthening exercises are the same as the other diseases. If the patients are taking the beta blocker or any other medication that affects the heart rate, they may feel that somewhat hard during the exercise program. You need to stop the exercise if the blood pressure is more than 200 by 115 millimeter mercury. It's advisable to measure the blood pressure before you start the exercises. Now comes the exercise for the atrial fibrillation. Safety exercise can slow the heart rate, lower the blood pressure, having a good quality of the life, and relieve the anxiety and stress. The aim of the exercise is to perform more exercise bouts for the shorter duration and early stage, and gradually progress to the longer durations for the fewer times per day. This sample on the right-hand side is a weekly exercise program. The exercises are the same. The aerobic activity exercises, strength training exercises, yoga, Tai Chi, Pilates, and the stretching of the key muscle groups are recommended. If the patient is feeling with the lightheadedness or the chest pain or pressure, you should immediately stop and rest for a while. If the patient has the more serious symptoms, like the passing out or the intense chest pain, it's better to visit the hospital emergency room. Aerobic activity is good, but do not push your limits. Regarding instead of the patient with heart failure, we usually follow the guideline for the phase 3 rehabilitation, which includes the exercise and the educational programs. Aerobic activity is recommended at least 150 minutes per week for the moderate intensity. And then it's better to avoid the exercise in the extreme weather, and the flexibility and the stretching of the muscles. Stretching of the key muscles 2 to 3 days per 2 to 3 days per week is essential. For the patients with valvular heart disease, you better choose low impact activities such as walking, cycling, or the water exercises, which involve the large muscle groups, and it can be done continuously. If your fitness level is low, it's better to start with the shorter sections, about 10 to 15 minutes, and gradually build up to 20 to 60 minutes a week. If the individual has a significant aortic stenosis and pulmonary stenosis, it is better to avoid the strength training. So you can stop the exercising if you experience a chest pain or angina, and contact your physician immediately. Regarding the exercise for the patients with chronic liver and kidney disease, it is advisable not to drink excessively because of your kidney disease. It's better to limit the salty foods as well. Physical activity should ideally be performed on the non-dialysis days. Every activity was slowly built up to doing at least 150 minutes per week with a moderate intensity. Strength training, flexibility training, yoga, Tai Chi, and Pilates are also better to improve the patient's condition. For the patients with prediabetes and diabetes type 2, muscle strength training and muscle conditioning like yoga, stretching, or toning activities are associated with the reduced risk of the type 2 diabetes. It is recommended at least 2.5 hours per week of the moderate to vigorous physical activity to prevent onset of the type 2 diabetes in adults at high risk. For the type 2 diabetes patients, physical activity goals should be a minimum of the 60 minutes per day of moderate to vigorous physical activity, which includes strength-related exercise at least 3 days per week. This is a detailed exercise program for the pre-diabetics and diabetic patient, type 2 patients. These are the benefits of the exercise in diabetes. Because of the time limit, I will skip these slides as well. Now comes the exercise for the low back pain. Low back pain, it is essential to reduce the activity during the acute phase of the pain, but it is typically not a bed rest. Relaxation, flexibility, aerobic activity exercises, strengthening training, especially core muscle trainings, diaphragm, abdominal muscles, back extensions, and pelvic floor muscles, strengthening the key components to relieve the low back pain, which will be followed by the postural awareness, yoga, Pilates, and Tai Chi will have balance, strength, and relaxation. Also, the avoidance of the faulty body mechanics and the education and counseling to the patients is essential to prevent recurrence of the chronic pain. Exercise for the fibromyalgia, back pain, also arthritis and activity limitation. We usually recommended flexibility exercises for all the large muscle groups. Muscle strengthening exercise, both upper and lower limb. Balance and postural exercises are recommended according to this similar program with the other diseases. For the Alzheimer's diseases, the program should be adjusted based on the patient's symptoms and physical status. It should be realistic about how much activity can be done at one time. Multiple mini workout sessions during the day may be the best. It is better to keep an exercise log. And exercise in the morning might work better, as morning is often when people with the Alzheimer's have the lowest severity of the symptoms. You may add the preferred kind of the music to the exercises so the patients have more fun. Exercising several times a week for 30 to 60 minutes per day for the Alzheimer patients, and it can keep thinking, reasoning, and the learning skills sharp for the healthy individuals, and it also improves their cognitive function. These are the detailed programs of the Alzheimer's disease. Regarding insight for the anxiety and depression, exercise decreases depressive symptoms by increasing the brain neurogenesis. 4 possible molecular substances for increased neurogenesis are beta endorphins, vascular endothelial growth factor, brain-derived neurotrophic factor, and serotonin. Exercise also improves the self-concept in depressed patients, possibly leading to the decreased depressive symptoms. Aerobic exercises and the strength training, as well as the flexibility, the yoga and Pilates and the Tai Chi are recommended. Regarding the exercise for cancer patients, we also recommend aerobic activities, strength training, and other types of physical activities. It is recommended that the patient should stay safe and injury-free, and the program should gradually increase according to the patient's pace and time spent being active. It's better to start low and go slowly. For the bleeding disorders, hemophilia patients, on the left-hand side, these are the joints affected by the hemophilic bleeding, and the right-hand side is the deformities and contractures caused by the hemophilia patients. For the exercises, it should be slow and steady. Isometric exercises are an excellent way to begin exercising if muscles are very weak or if the joints are very painful with the movement. If you experience a new pain during the exercise, it is important to be analyzed very carefully. Whether is this a muscle fatigue, or it may be caused by the sign of the new bleeding, or is the exercise placing too much strain on the damaged joint. For the osteoporosis, it is important to strengthen the bone health and increase the bone mass. Aerobic or weight-bearing exercises are essential and mainstay of the treatment for the osteoporosis. At least 150 minutes per week of the moderate intensity aerobic activity or 75 minutes for the vigorous aerobic activity are recommended for the adults. Muscle strengthening exercise should be carried out twice a week. Swimming, water exercise, and biking are good aerobic activities, but they are not weight-bearing, and they can do little to improve bone mass. It is twisting exercises, abdominal muscle, sit-up exercises, and then excessive trunk flexions are contraindicated in patients with osteoporosis. This exercise for the weight loss. It is recommended to do the regular physical activity and then take a healthy eating plan, and a healthy lifestyle is essential to reduce the weight. So you can start slowly and then gradually. So moderate intensity exercises like aerobic exercises and muscle strengthening exercises are essential. And you can gradually improve to the vigorous exercises when your condition is progressed. Regarding the exercise for the patient with HIV/AIDS, moderate intensity aerobic exercises and effective complementary therapy in lowering the blood pressure increases CD4 cell count in people living with the HIV/AIDS. Resistant exercises improve the body weight, lean body mass, muscle mass, and the muscle strength in the men with HIV. Strength training exercises increase the body cell mass, and muscle strength, and the quality of life in HIV-positive women patients. This is my take-home message. Regular physical activity and exercise can prevent many chronic diseases, reduce the morbidity and mortality. Precautions should be taken before studying the prescription of the exercise program according to the pre-fitness level of the patients, existing medical conditions, and the risk factors. This is a team from the Department of Physical Medicine and Rehabilitation from Yangon General Hospital. I'm very grateful to all of you and for your great effort and your support. Without your support, I cannot accomplish all these activities. Thank you so much, all. This is the end of my presentation. Thank you very much.
Thank you very much, Dr. Mue. As you can see, she has a very, very heavy number of PowerPoints, and she wants to impart all her knowledge to all the audience, and that is very evident. Exercise has become very interesting, especially from womb to tomb. You have to be physically active and perform all the exercises, which is of benefit to all. No, now touch very comprehensively, from the benefits of exercise to the importance of screening and the various medical conditions where you have to take, how much you have to take, right? So Q&A got all interesting Q&A, but at the same time, the individual answer look bibabi. So the answer look like that as time is running out, no? Very interesting questions, and which are also very practical. Interest here, but I would like to end the session because of time and the technical but if you have any questions questions more answer look be like solution, you can contact our secretary boss. Yeah, we are doing contact Lulu Yabare, Mamu or Omaru Alungo, contact Lulu Yabare, because this is very important, but so with this, I would like to thank all the speakers and also the academic committee, and to the very audience who have shown much interest in this topic, and to the ICT professionals who have helped us in performing this Zoom meeting. Thank you very much all. See you. Thank you very much.